And Omar had this really nice resource for you guys about like how to simplify and approach calling consults. So everyone gets worried about calling consults, but really there's no reason to be worried. For me, my perspective is I'm doing what me and my team feel is right for my patient and what I feel is best for our patient, even if the consulting services may or may not agree. Just really know that you are reaching out to them because you feel that this is what your patient needs. So the first thing you want to do is you always want to introduce yourself and let them know that you are calling for a consult or a follow-up, right? Sometimes we call them for a follow-up. So I would say, I'm Sue, I'm one of the residents, I'm one of the interns on the medicine team. I have a new consult. Is now appropriate time? They say yes. And then I say, okay, patient's name. I'm calling about Mr. Whoever, here's his last floor. This is where he's located in the hospital. And then I really narrow my question before I say anything else, right? So right away, once they have that question, whatever else I say, they'll be able to put it into that question's perspective. So our question essentially is further risk stratification for newly reduced heart failure exacerbation. And then you can provide them the story and the relevant lab. Obviously, don't give them an H&P. They don't have time for that, but just the relevant story, very brief, very concise of things that are relevant for them. And then tell them the urgency, right? So, and this becomes especially important if it's urgent or emergent. One of the things that immediately pops to my head is if someone's in ACS or if someone's having a GI bleed, this is very, very urgent and you want them to know that. And then I always end up with just making sure that I have some sort of plan, right? So what is the best way for me to follow up with you? Or when should I expect to follow up with you? Or what's the best way to reach you for for what your recommendations are? Just very simple and brief. I end with that. So in short, my name is so-and-so. I'm on the medicine team. I'm an intern on the medicine team. I have a new consult or I'm following up. This is the patient's name, MRN, floor and bed. My question, our consult question is essentially yada, yada, yada. And here's this concise history. I feel like this is urgent as they're having like bright red blood and there's hemodynamics, she's becoming unstable, yada, yada, yada. And then when should I expect to follow up with you and what's the best way to make sure that I follow up on all your recommendations? Done. And actually just one more thing. So sometimes we have consults where we're consulting on a service and they're technically called soft consults because we already have an idea about what's going on with the patient, but we feel like their input is important to the patient and their management and their treatment. And the consulting services, when they do get these soft consults or feel like we should be able to answer it ourselves, they may give some pushback. And so to kind of avoid that and to kind of just set the tone for them, a really good way that I've done it is just, this is, non-urgent, a soft consult. I'm so sorry, but we want your service to be involved in this patient's care. And we would really, really greatly appreciate your service's opinion. And again, I'm really sorry, but your opinion is really valued here. And if there's anything that I could do to kind of help facilitate this consult, I'd be more than willing to do that. And usually they take that pretty well.